Good morning and welcome to the August 8th, 2022 special meeting of the San Francisco Board of Supervisors. I want to thank everyone for being in attendance. This morning we have supervisors here in the chamber as well as some remotely. And again, this is a very important meeting, so I want to thank all of you for coming together during recess. Mr. Clerk, will you please call the roll?
Yes, on the call of the roll, Supervisor Chan. Present. Chan present. Supervisor Dorsey. Present. Dorsey present. Supervisor Mandelman.
Present.
Mandelman present. Supervisor Marr.
Present.
Marr present. Supervisor Melgar.
Present.
Melgar present. Supervisor Peskin.
Present.
Peskin present. Supervisor Preston. Preston present. Supervisor Ronan. Ronan absent. Supervisor Safai.
Present.
Safai present. Supervisor Stephanie. Stephanie present. President Walton.
Present.
Walton present. Mr. President, we have a quorum.
Thank you so much. And can I get a motion to excuse Supervisor Ronan from today's meeting? Made by Supervisor Stephanie, seconded by Supervisor Dorsey. Mr. Clerk, on the motion.
Yes, on that motion, President Walton.
Aye.
Walton, aye. Supervisor Chan. Aye. Chan, aye. Supervisor Dorsey. Aye. Dorsey, aye. Supervisor Mandelman.
Aye.
Mandelman, aye. Supervisor Marr.
Aye.
Marr, aye. Supervisor Melgar.
Aye.
Melgar, aye. Supervisor Peskin.
Aye.
Peskin, aye. Supervisor Preston. Aye. Preston, aye. Supervisor Ronan, excused. Supervisor Safai.
Aye.
Safai. Supervisor Stephanie. Aye. Stephanie, aye. The motion passes without objection, with Supervisor Ronan being excused.
Thank you. Motion to excuse Supervisor Ronan from today's August 8th, 2022 special meeting is approved. The San Francisco Board of Supervisors acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Colleagues, would you please join me in reciting the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America.
The United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you for that accompaniment, Supervisor Safai. And on behalf of the board, I would like to acknowledge the staff at SF-Gov TV. Today we have Jason Goldhammer, who record each of our meetings and make the transcripts available for the public online. Mr. Clerk, do we have any communications?
Thank you, Mr. President. The Board of Supervisors welcomes the general public to the Legislative Chamber here in City Hall, room 250, to both listen to the proceedings or to advise the board in person. This meeting is airing live on SF-Gov TV's award-winning Channel 26, or you may view the live stream by going to www.sfgovtv.org. Alternatively, you may participate remotely via the call-in system. Best practices is to call in early from a quiet location, and once it is your turn to speak, make sure that your sound is turned down. The board will prioritize hearing testimony or comments from those who are attending in person. Thereafter, the board will hear from those who called into the remote system. Please note the remote system will be open one time, and once closed, it will not be reopened. Throughout the meeting, the telephone number is streaming On your screen, the number is 1-415-655-0001. When you hear the system prompt, enter the meeting ID of 2490-070-5729. Press the pound symbol twice. You will know you have joined the meeting once you hear the discussion. However, your line will be muted. Once you are ready to provide comment, press *3 to put yourself into the speaker queue. The system will prompt you have been unmuted and begin your speaking, and you may begin your comments. Today's special meeting has 2 items, each with their own public comment opportunity. There is no general public comment item. Communications with the board is still possible by sending written correspondence by U.S. mail to SF Board of Supervisors, number 1, Dr. Carlton B. Goodlett Place, City Hall, room 244, San Francisco, California, 94102, or send an email to the email address of bos@sfgov.org. In great partnership with the Office of Civic Engagement and Immigrant Affairs, interpreters will be present. At that time, I will invite the interpreters to introduce themselves and to provide the access information to the remote meeting in their language. Finally, if you have any questions accessing the meeting, call the clerk's office. We have a live person standing by to assist. The phone number is 415-554-5184. Members, Mr. President, that concludes my communications.
Thank you so much, Mr. Clerk. And we are now at our first item for adoption without committee reference, item number 1. Mr. Clerk.
Yes. Item number 1 is a motion to make findings to allow teleconference meetings.
Thank you so much. And before we vote on this item, we do need to hear from the public on item number 1.
Yes, for those who of you who took time to come down to the board chambers, we are prioritizing your public comment. Please line up on the right-hand side of the room against the curtains. We ask that you adjust the microphone so that you're able to speak directly into the system to provide your comment. Can the first person in-person speaking please come forward and begin your comments? You will have 2 minutes to speak. There does not appear to be anybody in person to speak on this item. We are now checking our remote system. Mr. Atkins is now checking to see if we have any remote attendees who would like to speak. If you called earlier on the phone and you have not already done so, please press *3 and wait until the system indicates you have been unmuted and just begin speaking your comment. Are there any speakers?
Yes, hi. I'm curious as to why there's no general public comments. I've been meaning to comment. I just, I think that people that serve on the Board of Supervisors need to be respectful of people that are perceived to be, I guess, beneath them, but that's a bad word, like in lower roles and capacities, and not make comments that are inappropriate.
Mr. Clerk, this is specific to being able to provide a remote meeting, and so comments need to be directed towards item number 1.
Thank you. Excuse me. I believe that was
Mr. Clerk, there are no further callers in the queue.
Thank you, Mr. Atkins. There are no additional callers in the queue for this item.
Thank you so much. Seeing that there is no other public comment is now closed. Mr. Clerk, would you please call the roll on item number 1?
Yes, on that motion, President Walton.
Aye.
Walton, aye. Supervisor Chan. Aye. Chan, aye. Supervisor Dorsey. Aye. Dorsey, aye. Supervisor Mandelman.
Aye.
Mandelman, aye. Supervisor Marr.
Aye.
Marr, aye. Supervisor Melgar. Supervisor Melgar. I will come back just in case you got disconnected. Supervisor Peskin.
Aye.
Peskin, aye. Supervisor Preston.
Aye.
Preston, aye. Supervisor Ronan, excused. Supervisor Safai.
Aye.
Safai, aye. Supervisor Stephanie. Stephanie, aye. Supervisor Melgar.
Aye. Sorry about that. I couldn't mute fast enough.
Melgar, aye. The motion passes without objection, with Supervisor Ronan being excused.
Thank you. Without objection, this motion is approved unanimously. Mr. Clerk, please call item number 2.
Yes, item number 2 is a motion to ratify the San Francisco Health Officer's August 1st, 2022 declaration of local health emergency regarding the outbreak of the monkeypox virus.
Thank you so much, Mr. Clerk. And we do have representatives from the Department of Public Health here. We have our Director of Public Health, Dr. Colfax, as well as our Chief Health Officer, Dr. Phillip, and Anna Velizdik, representing the Department of Public Health. So thank you so much. Dr. Colfax.
Oh, my apologies.
Thank you very much, and good morning, President Walton and board members. Just thanking you on the department's behalf for convening a special session today to consider ratifying the health officer's declaration of a health emergency on monkeypox and the outbreak in San Francisco. You know, as a gay man who came out and both professionally and personally during the height of the HIV epidemic, I personally experienced and saw my friends and colleagues and loved ones experience the stigma and discrimination during another height of the pandemic, the HIV epidemic. And the stigma and discrimination that so many of our community experienced then is unfortunately being experienced again today in the face of monkeypox. And I want to assure you that both from a personal, professional, and a department-wide perspective, we are committed to ensuring that the stigma and discrimination is being confronted head-on and ensuring that the community most at risk, the LGBT plus community, in particular, men who have sex with men, gay men, and trans men, who currently compose of over 95% of the monkeypox cases in San Francisco, that people are getting evidence-based, up-to-date, accurate, and culturally congruent information about steps people can take to prevent the disease, where people can go for vaccines, and how to access treatment. We are committed to doing it in a way that supports people's health and wellness, including ensuring that they have the information they need to make decisions about maintaining their sexual health. This declaration today will help the department ensure we have all the tools available to augment our outreach, vaccine distribution, education, testing, and treatment efforts, including in the communities who remain at highest risk. And it is now my pleasure to introduce Dr. Susan Phillip, the health officer for the city and county of San Francisco, who has been leading our efforts in the department with an incredible team who have partnered with our community members to, again, ensure that we're doing everything we can to mitigate the impact of monkeypox in our community. Dr. Phillip.
Thank you so much, Director Colfax, and good morning. And let me add my sincere thanks, President Walton and the Board of Supervisors, for calling this special meeting to ratify the declaration of a local health emergency on monkeypox outbreak in San Francisco. As of 5 o'clock in the afternoon on Friday, August 5th, SFDPH has confirmed 444 cases of monkeypox in San Francisco. These are both probable and confirmed cases, and we anticipate more will occur. Due to this rapid increase in cases, I declared a health emergency on the monkeypox outbreak in San Francisco on August 1st, 2022. I issued this declaration to direct and harness resources, including efforts to obtain additional vaccine supply. It will allow DPH and other health providers to prepare for an increase in cases, given the current trajectory. I also issued this declaration to raise awareness and help educate people who may come into contact with the virus about how to protect themselves and those around them. Additionally, U.S. Health and Human Services Secretary Becerra and Governor Newsom announced emergency declarations last week regarding monkeypox outbreaks in the United States and California, respectively. I urge you to ratify this declaration of a health emergency for monkeypox outbreak in San Francisco today. As cases continue to increase in San Francisco, the demand for vaccine is high, and it is needed to stop community spread. Without enough vaccine supply, SFDPH has trouble fulfilling its basic duty of keeping communities safe. This week, San Francisco has been allotted an additional more than 10,000 doses of additional monkeypox vaccine from the state via the federal supply. This will start to be administered to people this week. This is double our previous 2 allocations, but nowhere near what we need to combat this outbreak. SFDPH has requested 35,000 doses just to begin to meet the need, but it's only received 22,000 doses to date, including this most recent allocation. The city's been working diligently to increase the implementation of vaccine distribution, testing, and treatment in response to the spread of the monkeypox virus. SFDPH will continue to request additional vaccine allocations from the state and distribute them to community clinics, health systems, and other locations where they are needed and can be accessed by the people who need them. While the monkeypox virus impacts all people, our data, as well as around the state and the country, show significant spread in LGBTQ communities at higher rates. This remains true in San Francisco as well. However, it is very important to recall and to note that anyone, regardless of sexual orientation or gender identity, can be infected and can spread monkeypox. Again, I urge you to ratify this declaration of a local health emergency today. I expect to bring the declaration back to you, the Board of Supervisors, as needed to continue the declaration for as long as the emergency persists. Thank you, and I'm happy to answer any questions you may have.
Thank you so much, Dr. Phillip. Supervisor Mandelman, I do see you have a couple of questions. Thank you so much.
Thank you, President Walton. Thank you for convening us to reaffirm this emergency declaration, and thanks to Dr. Phillip and DPH and the mayor for recognizing the health emergency in San Francisco, and for all of your advocacy to get San Francisco the vaccination doses that we need. I do have a few questions. One relates to this story that's broken in the Mercury News about San Francisco pulling back from contact tracing on monkeypox, and I'm wondering if you can explain what is going on there and why that makes sense, if it makes sense.
Yes, thank you very much, Supervisor, for the opportunity to speak to that. So when the initial monkeypox cases were detected in San Francisco, we were reaching out to every individual where the laboratory had reported a positive case. And we continued doing that through the spring and into the early part of the summer. And what our case investigation and contact tracers identified is that we were doing this in order to try to get vaccine to the people who were named as contacts to the cases, because those people were at highest risk for developing monkeypox, and by vaccinating them, we could prevent them from developing a case themselves. But what we found is that people were not able to or were not willing to talk with us about the names of the people who might have been exposed, and we certainly understand that that can be a concern. And we also support self-disclosure so that we give people information to pass along to their partners or to others they may have been in contact with. And because that strategy was not yielding people who were then we were able to direct vaccine to, and we were holding vaccine supply in order to give them to those people, we then had to pivot to a broader strategy of communicating about spread of monkeypox as it became clear that there was person-to-person spread in the community. It was not just tied to travel to parts of Europe or other parts of the world that had previously seen outbreaks. So that is the evolution. I mean, but still to date, we have reached out and talked to over 72% of the cases as of August 22 of people who have been identified with monkeypox. And we continue to prioritize people who are under 18 and people who are pregnant or who could become pregnant because of the concern for more severe illness in those individuals. For others, we are supporting them with information on how to disclose to their partners and to others, and we stand ready to provide additional assistance if requested.
Okay. My other question relates to, as we now are have received this larger shipment of 10,000 doses, and as you now have this emergency authority, I mean, one of the more unseemly aspects of our distribution of vaccines has been these incredibly long lines with folks kind of getting to general ever earlier in the morning to try and be in line to get those vaccinations. I got my vaccine last Monday. I got there at 5:30 in the morning. I was the 123rd person in line that morning. My understanding is that that's been continuing, and there's no reason to think that that's not going to be the way people continue to try to access this vaccine, but it doesn't make sense. I mean, what makes sense is to be able to go online somewhere and, identify a time and sign up much the way we did for the COVID-19 vaccines when they were being distributed out of Moscone. So is there any plan to use your emergency authority to create a vaccination distribution system that makes more sense?
Thank you as well for that very good question. I'm going to answer a couple of parts of that. And the first is, to directly answer your question about using the authority from this emergency declaration to look at different ways in which we can expedite and simplify the process of getting vaccine for people. And certainly we do want to do that. And what we'll be exploring are ways in which we can use partnerships, including vendor partnerships and contracts, to be able to do some of this work and to also have additional people helping us from within the department to think about this work. So certainly there is a possibility, and we will be exploring all avenues to make vaccine access more simple. The state of California has said that they are going to utilize the system that they have used for COVID-19 vaccine, My Turn, and they are programming that to incorporate monkeypox for multiple county and across the state searches for vaccine, and that could be helpful as well, but that will happen later this month, they anticipate. In terms of getting vaccine and the waits that people have had, I will say that there have been criticisms in other jurisdictions that have done entirely online systems because those appointment slots go very, very quickly. And there's concern because there's some lack of clarity about how a person gets those slots as well. So there's concern in both directions, both with the lines that people have to do, as well as where and how people might have the ability to get those coveted online appointment slots. What we have done is a combination of both of those things, and I think at this point it's very important to remember that the vaccine clinic at General, while it is incredibly important and our highest volume site in the city, is not the only place that people can get vaccine. We have been working really closely with our partners at Kaiser, at UCSF, at Sutter, and really happy to say that people who are affiliated with those health systems can get vaccine through their providers and through call centers that are associated with those systems as well. So people now do have multiple routes to get vaccine. And as you said, we really are making it a priority to continue to try to improve that system even further so people don't necessarily have to wait and spend hours in line. And as our vaccine supply increases, the options will increase further.
I mean, this may have changed, but the experience through the hearing that we had a couple weeks ago on this was that folks who were being directed to call the city's lines to make phone lines to make appointments were not getting calls back, and were having an experience every bit as frustrating, which was what was part of what I think was driving people to the lines. And I understand not wanting to take the pressure off the Kaisers and the Sutters and the UCSFs, but I also think we need a way that makes sense to get vaccines to people, and it shouldn't be on individuals who are trying to do the right thing and get vaccinated to wend their way through an impossible access system.
Thank you.
So I would urge you to look at maybe partnering with the state if they're moving to an online appointment-based system to figure out a way to get our county doses into that. And I think those are my questions. Thanks.
Thank you, Supervisor.
Thank you so much, Supervisor Melderman. Supervisor Dorsey, did you have something? Okay, thank you, Supervisor Dorsey. Supervisor Chan, I do have Supervisor Safai and Supervisor Mar on the roster. Supervisor Safai?
Thank you, President Walton. I just have a quick question, Dr. Phillips. My understanding is, and we're talking about vaccine and access to vaccine and ensuring that we have, which we've only had 22,000 doses to date, which we need a lot more of. Asking for and
Okay, let's see. I can do a board meeting and this at the same.
Supervisor Peskin, can you?
Aaron.
He's muted.
Utilizing a smallpox vaccine. Can you talk about that for a minute and why we haven't moved aggressively to access that, which I understand we have a lot more doses available that could be utilized, unless I'm misinformed. So I just wanted to give you the opportunity to comment on that and ask why we might not be doing everything we can to get that as well.
Thank you. Thank you very much for that question and the opportunity to speak to this point. Yes, well, you are correct that there are doses of smallpox vaccine, which previously had been available and is still available to use. That vaccine is what's known as a live and replicating virus. It's a weakened virus, but it can still replicate within the human body. And the current vaccine, the Jynneos, does not have that feature, that function. The people who could benefit from the older vaccine, the smallpox vaccine, is more limited. For people who have certain immune compromising conditions, people who are living with HIV that's not controlled, and others, it can really be dangerous to have that weakened virus replicate actively, cause more disseminated lesions after vaccination, which could then cause harm to themselves, make them quite sick. And certainly if they are living with other people, it could also spread to them if they're young children or people who may have medical conditions in the household. So there are safety issues that are related to that vaccine, and that is the reason why you have not seen other jurisdictions move to using the smallpox vaccine. And it is a risk-benefit trade-off. If we did have an outbreak of smallpox, or if there was an event where smallpox was released, the risk of that virus is so severe, it causes death so much more often, that it is worthwhile to have the entire population take on the risks of that smallpox vaccine. But with this virus, what we are really trying to do is utilize the much safer vaccine so that we are not inadvertently causing harm to people in our population by giving them the smallpox vaccine.
Thank you.
Thank you, Supervisor Safai. Supervisor Mar.
Thank you, President Walton. Thank you, Dr. Phillip and Colfax for this, and also Mayor Breed for this declaration of public health emergency on monkeypox. I did have a few questions and then a comment. First of all, it's my understanding that DPH, as of now, is not prioritizing contact tracing for the identified cases, and that is concerning to me. I also understand that there's been now cases confirmed in our county jail system and in navigation centers. So I just wanted to see, Dr. Phillip, if you could explain why DPH is not prioritizing contact tracing for monkeypox.
Thank you, Supervisor. So what we are doing is really trying to focus on individuals who are at most risk for severe outcomes, or individuals who are outside the general groups that we are seeing with monkeypox. And that includes people who are under 18, people who are pregnant or who could become pregnant. And whenever, as you said, we hear about cases in congregate settings, we are focusing on outbreak prevention in those settings. So our nurses and our case investigators have shifted from following up on every individual case to really trying to understand about cases that are occurring in settings where people are gathered really close together, such as shelters and other congregate settings, to be able to focus their work there to support staff and to support testing and vaccine provision and investigating who has actually come into contact with a person who is a case. Now, in terms of the jail here, the San Francisco jail, that is not a confirmed case in the jails, and we're waiting to get the test results there. But yes, it is a concern, and we're working very closely with the leadership of our jail health services, which is part of the Department of Public Health. Dr. Lisa Pratt and her team are working very closely with me and with others in the case investigation and contact tracing team to think about how we might do everything we can to prevent spread and to protect individuals who are in that setting.
Thank you. And Dr. Phillip, can you describe what support we're providing for individuals that have tested positive with monkeypox, including isolation, housing, if needed, and particularly around that isolation housing, like we were providing or offering to COVID people who tested positive for COVID.
Thank you very much for that question. The contracts and the agreements that we have in place were specific for COVID. So at this point, we're very limited in what we can offer in terms of isolation rooms or places for people to isolate. We are working with people to make sure that they have information and trying to see if there are other existing resources where those could be helpful, but we don't have the same. We do not have the same volume of rooms or ability to refer people for isolation for monkeypox.
Okay, and then one final related question is around. Well, actually, first I did want to thank San Francisco voters for passing Proposition G in June that made public health emergency leave permanent for the COVID pandemic, but also future pandemics, and now with the declaration of a health emergency of monkeypox, the supplemental paid leave that will be available for to be used for monkeypox for individuals who test positive for monkeypox. Proposition G doesn't go into effect until October 1st, so there is going to be a couple months. Where at least it's not required, the supplemental paid leave is not required, for folks with monkeypox to use. So I just wanted to urge employers, to actually offer the extra paid leave, during these 2 months until public health emergency leave is in effect on October 1st. We looked into a possible emergency ordinance creating public health emergency leave for monkeypox, but it would have, the timing didn't work out. So, but Dr. Phillip, I did have a question. Is the city able to continue our supplemental paid leave for monkeypox, and also other programs that we had created to support folks during the COVID pandemic, like the Right to Recover program, where there was also financial compensation for workers that needed it.
Thank you, Supervisor. My understanding is that the Right to Recover funds for COVID are themselves limited, and that we have limited ability to continue to administer those. And we do not have an additional or separate ability to do that for monkeypox at this time.
Mm-hmm. Okay. Well, thank you. And colleagues, I think these are issues that I think we should really look into as additional steps that we can take, as a city to address the monkeypox, the growing monkeypox health threat, and support folks in our community that have tested positive. So that's something that I look forward to taking up when we come back in September. Thank you.
Thank you so much, Supervisor Marr. Supervisor Chan.
Thank you, President Walton. I just want to continue along the line of questioning that Supervisor Marr just had specifically about Right to Recovery or Right to Recover program, and try to understand that with the declaration of public health emergency locally to allow this to be extended beyond today until you said otherwise, what then will allow us with this declaration that we can actually do Does that mean that not at this immediate moment, but eventually that we could have the right to recover program and some other components that we had with COVID? And if so, what is the timeline and what does that look like?
Thank you, Supervisor. This public health declaration of emergency is really, it's more focal than our overall citywide emergency with COVID, and it really is focused on what we're able to do as public health and what I can do as health officer. So the concrete things that it allows is it really requires that entities provide information to the health officer. We've declared an emergency, so if we want to understand who's getting vaccines in their location or who they're seeing and their treatment, they are required to give that to us. It also gives us some ability to really work within the department to try and align resources towards responding. But in terms of sort of larger programs and setting up programs that had been outside of the department, we remain limited in doing that. So we're exploring all the partnerships and all of the contracts and other things that we had in place for COVID-19, and certainly where we're able to, we want to try to leverage some of those similar things. But what it doesn't do is it doesn't create any new funds. And as you know, even the COVID-19 funding at the federal level has not come through to continue. And there hasn't been, even though there's a federal declaration of emergency, no additional appropriation of monies to the states and to the local jurisdictions. So that remains a challenge.
Understood. And so does that mean that with this declaration of emergency, we could continue the conversation to see if there are ways that the city and county of San Francisco can actually advocate state and federal fundings for the right to recover, or that we should continue this conversation and perhaps with the mayor's office that we can actually really start thinking about, and hopefully with our budget chair to think about the right to recover program and expanding it?
Yes, Supervisor, I think that this declaration puts us in a position we're poised to say it's an emergency, and that we as a department and I as health officers continue having all possible conversations with elected officials and leaders to understand how as a city we can wrap around the need. And we really are advocating for vaccine as a biomedical first line prevention, and we know that there are additional needs as well.
Great. I mean, I think that I do want to highlight what Supervisor Marr just mentioned, the fact that, because of the voter has actually approved for public health emergency, additional 2 week of pay on top of pay sick leave, but it doesn't kick in October. So I think that the thought is really between now until October. Like, how can we as a city, perhaps during this time of emergency, that can actually allocate fund? And we look forward to hearing more from you and to give us the advice along with the data that you now can gather, and to give us a better picture about the population that needs it and how many people needs it, and can we actually get the scope of the needs and be able to expand the program. So thank you.
Thank you very much, Supervisor, and that data, certainly happy to work with you on that.
Thank you, Supervisor Chan. Supervisor Preston?
Thank you, President Walton, and just wanted to thank Dr. Phillip and Dr. Colfax and folks at DPH for all of their work. I asked my questions in committee when we had in GAO when we had the hearing on monkeypox response, so I don't have additional questions. I did just want to really extend my thanks and really recognize the leadership and work of our colleague Supervisor Mandelman from really the early days as cases were breaking, of really highlighting the need for the city to be more proactive in monkeypox response and bringing the Board of Supervisors into that discussion through the hearing that he called for. So I wanted to thank him, as well as community advocates that I think have really taken the lead in elevating the need for a stronger response, including Alice B. Toklas Club, the Harvey Milk Democratic Club, and community-based organizations like the AIDS Foundation and others who have really been stepping up. So just wanted to thank all the advocates who've been pushing us, and also folks doing all of this work in community and at Department of Public Health. And I want to thank you, President Walton, for sponsoring this, and Dr. Phillip for issuing the declaration. So obviously, let us know what we can do. I think we've been at our best when it comes to emergency health response when we are pushing health officials, but also figuring out how we can best back them, especially as we are making demands on the federal government here and trying to do so with one voice. Thank you.
No, thank you, Supervisor Preston. And I again do just want to piggyback on your comments. Specifically, want to thank a lot of our city leaders who stepped up and understood that this was something that we needed to get in front of a while ago. And so I do want to thank Dr. Phillip for declaring the state of emergency, as I stood with my colleagues and with Mayor Breed and, of course, the leadership of DPH and a lot of our city leaders not last Thursday, but on the 28th to declare the state of emergency, particularly knowing and understanding that we are in a pandemic and quick responses are how we do everything we can to prevent further outbreak. And so I too just want to say that we stand 100% with all affected communities, the LGBTQ plus community or Latino community, and any affected and vulnerable population. And this emergency will allow us to have the focus that is needed for us to do everything we can to get in front of this. Because we are in the middle of a pandemic, we don't want to repeat some of the same or learn some of the same lessons that we have in the past. So thank you so much. Just really one question, Dr. Phillip, and forgive me if you addressed this, but just making sure, how will this emergency help with special populations, like when we look at all the people in custody, or even your staff that serve folks in custody, nurses, doctors, and also our sheriffs, and then looking at the effects of what could happen in our shelters as well?
Thank you very much, President Walton, and again, very much appreciate your leadership and being there with us from the very beginning of this declaration and announcing that it was coming. What this public health emergency really does is to focus us as a department and to focus us as a city to say, here's why monkeypox is important. Here's why we have to use every possible way that we can within the Department of Public Health to utilize our resources to serve people who are most likely to have monkeypox and most likely to have where there is most likely to be spread if monkeypox is introduced. It also is, as you and others have mentioned so importantly, a message to the state and to our federal partners that we stand ready to put and focus our abilities, which are significant as a department and as a city with our partners to really combat this. And what we need are the resources, specifically the Jynneos vaccine, to be able to do that. And that's really important. And as a department, we're working very closely with our colleagues at Jail Health. We're working with our colleagues that work in shelter health and do whole person integrated care with people who might be experiencing homelessness. And we already have, through that mechanism, been able to allocate and to get vaccine that we are reserving for things like outbreaks, reserving for places like congregate settings where we need to prioritize getting vaccine quickly. We have that in hand, and we're able to work with those partners to get vaccine to those locations. So that's a practical way in which which we are utilizing our ability to move resources and to prioritize this as a declared emergency to be able to do that work. And I really also appreciate Supervisor Preston's remarks about community, and I really want to emphasize that our community partners writ large, our health system partners who are asking us for more vaccine, and they are opening up their vaccination clinics not only to their patients and members, but to the general public to make vaccine available. And that's not happening in every jurisdiction, I know from talking with colleagues. And our community organizations who are also using their expertise, advising us about how we should proceed. And this whole thing is a very rapid improvement cycle. So we are getting input and adjusting messages, adjusting the ways in which we get information out and the places that we send vaccine, and we will continue to do that. So this declaration really formalizes all the work that has already been happening even before we declared on the 28th, that we were going to make the declaration on the 1st. We talked about it on the 28th. Even before that was happening, all this work was happening, and I think it really helps us, again, to utilize every lever we have in the department to ensure that people can stay as safe as possible during this outbreak.
Thank you so much, Dr.
Thank
Phillip.
you.
Supervisor Dorsey.
Thank you, President Walton. I did want to join my colleagues in just expressing gratitude to my colleagues for their leadership, and especially Supervisor Mandelman. I wanted to mention too, Speaker Nancy Pelosi, whose advocacy on public health has been heroic in this, as it has been through the AIDS crisis and COVID. Mayor Breed, Dr. Colfax, Dr. Phillip. I'm one of a handful of openly HIV positive people in public office today, and I'm very proud to represent a city or come from a city that whose approach on public health is known as the San Francisco model, and part of that is its full partnership with community-based organizations like the San Francisco AIDS Foundation, Alice B. Toklas Club, Milk Club. And I know that even around Dory Alley, we saw some of the stigmatizing playing out in that. And I appreciate the leadership of the Department of Public Health and being able to work in partnership on that. So that's it. I just wanted to make sure that we speak with one voice in gratitude for how we're approaching this.
Thank you, Supervisor Dorsey.
Thank you so much, Supervisor Dorsey. And I don't see any of my colleagues that wish to speak further. So thank you so much, Dr. Phillip, Dr. Colfax. Before we take roll on the item, we do have to wait for public comment. And I do just want to remind the public and let everyone know, both in the chamber and who are calling in, public comment today is specifically to item number 2, to ratify the health officer's declaration of a local health emergency regarding the monkeypox virus. This was a special meeting called specifically to deal with addressing, to do everything we can to stop the spread of monkeypox. So I do apologize for no general public comment, but if you wish to speak on anything outside of item number 2, we'll have to redirect you to another meeting. Mr. Clerk.
Yes, at this time, the Board of Supervisors welcomes your public comment on ratifying the County Health Officer's declaration of a local health emergency regarding monkeypox virus outbreak. We will hear public comment from those present in the chamber, and then we will take those joining us remotely. To provide your testimony remotely, you will need to connect to the remote call-in system by dialing the telephone number streaming across the screen or your computer screen at 1-415-655-0001. You will hear the prompt, and then you'll enter the meeting ID code of 2490-070-5729, then press the pound symbol twice. You'll have joined the meeting, but you'll hear the discussion and you'll be muted in listening mode only. Once connected, you press *3, and the system will indicate you have raised your hand. Please continue to wait and listen until the system indicates you've been unmuted, and that will be your cue to begin your comment. The Board of Supervisors will accept written correspondence by U.S. mail at San Francisco Board of Supervisors, 1 Dr. Carlton B. Goodlib Place, City Hall, Room 244, San Francisco, California, 94102. Or you can send us an email at bos@sfgov.org. We are joined by our partners from the Office of Civic Engagement and Immigrant Affairs as we welcome our friends. I ask that each interpreter introduce themselves and provide instructions in language on how to connect to the remote system and provide public comment. I believe our first one is Arturo with Spanish.
Buenos días, me llamo Arturo Cosenza, soy un empleado de la Oficina de Participación Cívica y Asuntos Inmigrantes y estaré prestando servicios de interpretación hoy para esta reunión. Para dar su comentario público, por favor, marque 415-655-0001, seguido por el código de acceso 2490-070-5729, más la tecla de numeral 2 veces. Luego presione asterisco 3 y antes de empezar a hablar, espera que el sistema le diga que su línea ha sido activada o en inglés, you have been unmuted. Usted tendrá solo 2 minutos para dar su comentario. Gracias.
Thank you. I believe next will be in Filipino by Raymond Boras.
Magandang umaga po. Ito po si Raymond mula sa Office of Civic Engagement, Immigrant Affairs. Ay inyong katulong sa wikang Pilipino sa pagpupulong ito. Para magbigay ng pampublikong komento, tumawag po sa 415-655-0001. Gamitin po ang meeting ID na 2490-070-5729. Matapos po ito, pinutin simulang pandulong ulit upang makasali at madinig ang pagpupulong. Para magbigay ng pahayag, pinutin po ang *3 at hintayin po lamang ang hudyat na maaaring magsalita o madinig ang katagang you have been unmuted. Maaari po magbigay ng komento sa loob ng 2 minuto. Maraming salamat po. Thank you.
Thank you. Our next one is in Chinese by Vivian Liu.
大家好，我係劉姑娘，係三藩市民政及移民辦公室嘅職員。我今日將喺會議上為大家提供廣東話口譯服務。如果你需要發表公眾評論，請撥打1415-655-0001，再撥會議 ID 2490-070-5729，然後再按2次井號鍵進入會議。當輪到你發言嘅時候，按咪3號鍵，然後聽到裡面嘅錄音 You have been unmuted， 你就可以開始發言。發言時間係2分鐘。多謝 ，Thank you。
Thank you, interpreters. We appreciate you being available to provide important language services to the community. And please jump in once you hear our speaker in language. For those of you who took the time to come down to the board, we are prioritizing your public comment. Please line up to speak at this time. Is there anyone in the chamber for public comment at this time? Give me one moment. There does not appear to be anybody in the chamber for public comment on this time. We'll move on to our remote speakers. Mr. Atkins is now checking to see if we have any remote attendees who would like to speak. If you called in earlier on the phone and you have not already done so, please dial *3 and wait until the system indicates you have been unmuted, and that will be your cue to begin your comments. I believe we have 28 callers and 16 in line to speak at this time. Can we have our first caller, please? Okay, that user was an unattended line. We'll try that again later. We'll move on to our next caller.
Hello， 係廣東話。
係啊，我係你嘅口譯員啊。Hello。係好，係聽到。我係你嘅口譯員。而家咧，你慢慢講你個名先，跟住咧，你每講2句説話咧，就停落嚟俾我同你翻譯。咁你講清楚啲，發言清楚啲，好冇？咁然之後我哋開始啦。Please begin。
好啊，唔該。OK， 大家好，係我姓劉㗎嚇，我係支持呢個猴痘嘅緊急嘅情況嘅。華眾線咧。
Hello, everybody. My name's Liu. I'm supporting the monkeypox emergency declaration.
係呢個華眾線咧，呢個種族主義嘅行為咧，已經係受到警告啦。佢必須要辭職。
我哋而家係講緊猴痘啊，呢個interpreter is explaining to the audience we are talking about the monkeypox。係我哋而家係講緊猴痘呢個議題。
係啊，都係有關於其他噶嘛。而家啱講緊嗰啲。
Oh, okay. So I think one of the supervisor is racism. So I want him to resign. 你可唔可以講嗰個史三士嗰個名？係啦，係咩英文名啊？
係華眾線。英文名我唔係好記得喎，係叫華眾線啊。
Mr. President, this public comment.
Thank you, Supervisor Peskin. And thank you to our interpreters. If you could inform them that we'll have to go to the next caller if they do not stick to item number 2 for public comment.
Yes, I already decree. I already clarified for the speaker. Okay, let me do it again. 係啊，對唔住啊，呢個講者，因為你嘅議題唔係講緊我哋今日而家講嘅呢個猴痘嘅議題，所以我哋係停止你嘅發言嘅。OK。
OK， 正話已經講咗啦嚇。好嘅，唔該晒。
Thank you。
Can we have our next caller, please?
Hello?
Hello?
Hi, we can hear you. Please proceed.
你好。My name is Lou。
係，請問你停一停先，我係今日你嘅口譯員，咁樣請你咧就講你個名啦，清楚講你個名啦，咁同埋你每講兩句咧就麻煩你停一停，好冇？咁今日仲要重新俾你一次咧，而家呢個議題係主要係講個猴痘嘅緊急狀況、緊急令嘅啫。咁其他嘅嘢咧係麻煩你第時先至再講。The interpreter make a clarification to the LEP, the audience, say, please focus on the topic about the monkeypox emergency declaration, and yeah, please begin. 而家可以開始啦。
係啊，我咧好支持猴痘呢個緊急情況嘅，因為咧而家嚟講咧，
supporting monkeypox emergency declaration。
因為健康同埋安全咧係最重要嘅，而家呢個情況。咁健康嚟講咧
，healthy and safety is the most important things。
喺健康嚟講咧 ，Covid 未去，猴痘又嚟。如果俾猴痘蔓延嘅話，咁我哋個生活就更加之唔知點樣過啦。
For right now, the situations we're still in COVID, but now the monkeypox came to us, so we just so scared, and then we are afraid that the future.
咁另外講到安全問題咧，我最近有注意到。即係關於我哋嘅主席進入 City Hall 嘅時候，安檢嘅時候咧，就同一個職員講咗唔好嘅話，我覺得係咁樣係好唔啱嘅。我覺得佢應該道歉下台。
Recently, I find out that the safety issue, one of our supervisor, I believe that's the president, in the security chat in law.
I'd like to step in, and if you don't mind, please remind our public commenters that today's public comment at this time is only regarding the declaration of the local health emergency regarding the monkeypox virus outbreak, and that is the only public comment we can help at this time.
Yes, let me clear to the audience again. 對唔住呢位講者，因為我哋今日主要都係講嗰個猴痘嘅緊急令嘅議題，所以呢一啲係唔包含喺裏邊，咁我哋就唔可以再俾你講落去。
Mr. Atkins, if you can unmute this caller, see if they have anything to say regarding the item number 2. Caller, you've been unmuted if you have anything related to the subject.
呢位講者，如果你係有關於猴痘嘅緊急狀況令嘅議題要發表公眾評論咧，你而家可以繼續啦。
OK， 咁嗰個猴痘啊，我想知道咁佢而家睇啲報紙啊講咧就唔係普及到每一個人嘅，咁我哋將來係要點樣預防啊，或者點樣有冇啲推廣咧
？Right now, I heard it and then I read the newspaper. So far, right now, monkeypox is not a benefit everybody right now. And I mean, how can we do the prevention and what's the next step? 你仲有冇其他嘢講？呢位講者 ，Do you have any? Okay, that's it. Thank you.
Thank you. Can we have our next caller, please?
Hi. Can you hear me?
Yes, we can. Please proceed.
Hello. Can you hear me? Yeah, my name is Jessica. After hearing about the public comment, I support the monkeypox emergency. Yes, it's good for people. So also in the city, they should have a more requirement to tell people what to do and how to do. That's good for all people. I support the monkeypox emergency. Thank you.
Thank you very much. Can we have our next caller, please?
Oh, hi, hello.
You can proceed.
Hello. Oh, okay. Watson has attacked a black cadet with a demeaning racial slur imbued with centuries of racism, oppression, and injustice, and he should know the word.
No. This is out of order, Mr. President. Out of order.
Thank you, Supervisor Peskin. Please remember to keep your comments to item number 2, the declaration of the monkeypox health order. We are emergency order. We are here to ratify the monkeypox emergency order.
Thank you. Can we have our next caller?
Hello? Hello?
Hi. Please proceed.
Hi. Hello? It's my turn. Hello?
You can speak now. Please proceed.
I'm Wendy. 我同意關於支持嗰個猴痘嘅緊急狀態。
呢個講者請你等一等下，我係你今日嘅口譯員。咁係呢度有幾件事要你注意。第一咧係你一定係要講猴痘呢個議題，因為如果你唔講猴痘呢個議題咧，就唔係今日嘅呢個公眾評論嚇。咁另外咧，你就每講2句咧，你要停落嚟俾我同你翻譯 ，OK？ So interpreter already make the clarification for the audience, ask them to stick on the topic, monkeypox emergency order. So 你而家可以開始 ，please begin.
OK， 我係同意嗰個支持嗰個猴痘進入個緊急狀態嘅。
I'm very support the monkeypox emergency declaration.
Yeah， 但係咧，我覺得嗰個治安亦都好重要咯。我係嗰個即係話。
But I think the safety is really important too.
係咯，嗰個華仲線咧，我覺得佢即係咁樣講嗰啲話咧。
Thank you. We will go to the next caller after we take the speaker who is currently in the chamber.
Thank you, Supervisors. My name is Gary McCoy. I'm here in my personal capacity at this moment. I wanted to thank all of you here for your work on this, for really listening to the advocates, a large number of the actual advocates that are waiting to make public comment on this call right now. Thank you so much. I also want to say whoever made a coordinated effort to hijack public comment, to politicize something, this is not the place or the time.
I would ask that you yourself stick to the main subject.
Yes. This is something that is primarily at this time affecting the LGBTQ community. This has nothing to do with racism or politicizing anything else outside of this agenda item. Thanks.
Thank you. I would like to give an opportunity to our interpreters to re-emphasize the statement that we are only hearing public comment on the subject matter of the monkeypox declaration of emergency.
Thank you, Mr. Clerk. And also, would you just remind everybody that immediately if they begin speaking on something else, we'll go to the next caller.
Yes, I will do that. So basically, before the LEP speak, I will tell them strictly for hello.
We can hear you. Thank you.
Yeah, strictly forward the monkeypox emergency order. So I will do that again. Thank you.
Thank you.
Okay, can we have our next caller, please?
Hello?
Yes, we can hear
Hello?
you.
Yes, 我個名係 Sylvia， 我覺得而家新冠裏面咧就猴痘嘅問題咯。
請問呢個講者，你等一陣先嚇，呢度有兩樣嘢你要注意嘅。第一樣嘢咧，你今日而家呢個發言咧係有關猴痘嘅發言。其他嘅事項咧，你要第二次先至發言嚇。咁仲有咧，你係每講兩句啦，咁你要停落嚟俾我同你翻譯嚇。So the interpreter clarified that the audience has to stick on the monkeypox emergency order. OK， 而家可以開始啦。Please begin。
OK， 我覺得而家係新冠未完咧，猴痘嘅問題又出現啦，咁樣會影響我哋大家。OK。
So currently, Currently, I think we are really afraid that because the COVID pandemic is still here, and then the monkeypox came to us, so we are. Hello.
I believe they hung up.
咁樣會
Hold on. Sorry.
咁樣會影響 Hello?
Yeah, this situation will affect our life. 你係咪講完啊？呢個講者？
未講完啊，因為我等你翻譯啊。
係，你繼續啦，請你繼續啦。
咁樣會影響大家嘅健康同埋心理問題啦。咁樣我就重視呢個。
This situation will affect our normal life and mental health.
所以咧，我哋要重視同埋支持嘅猴痘緊急情況。
That's why I support the monkeypox emergency order. 你係咪講完啊？呢位講者？
然之後咧，就而家嘅治安就咪好安全咧。我認為
Thank you so much.
而家唔係講個治安問題啊！呢位講者，治安問題你等到留到下次先講啊，好冇啊
Thank you, Mr. Clerk. Next caller, please.
Hello? Hello?
Please proceed.
Hello? 係咪我啊？
係啊，係你啦，你可以講啦。但係咧，我同你重申一下咧，我係你嘅口譯員。咁你今日咧講嘅話題一定要係 monkeypox 嘅問題，好唔好啊？其他問題你留到下一次再講。So the interpreter clear that the public comments right now is only for the monkeypox. So 你可以開始啦 ，please begin。
係你好啊，我叫阿 Sam。Hello,
my name is Jan。
我今日係喺百忙之中嚟呢個聽證會嘅。
I come to this public comments today。
我支持我哋嘅猴痘緊急嘅狀態。
I support the monkeypox emergency order。
但係咧，我有一件事非常重要嘅要向我哋嘅supervisor 去講，因為我
Thank you so much.
你呢件事係咪講猴痘㗎
Thank you so much, Mr. Clerk. Let's go to the next speaker.
Can we have our next caller?
Hello，到我啦。
係啊，我係你嘅口譯員啦。今日咁你今日一定咧就你講慢啲，每講兩句要停俾我同你翻譯啦。同埋咧，你今日係只係對猴痘呢件緊急令作一個公眾評論嚇。咁你而家可以開始啦。
OK， 我支持猴痘緊急狀況。
I support the monkeypox emergency declaration。
What done with that？
乜嘢話？我冇聽清楚。
We need to flag this one again. Again, we need to provide a reminder that we are only hearing public comment on the monkeypox emergency declaration. We will not be giving any additional warnings. If you stray off the topic, your line will be cut and we automatically move on to the next caller. If our translator can let our speakers know that, it would be appreciated.
Let me clear to the speaker right now.
Okay,
咁
thank
我
you.
再一次講咧，今次呢個公眾評論咧就只係講喉痘嘅咋。咁如果你有其他嘅論點你要發表咧，咁你係要留到下一次嘅。如果唔係咧，我哋就會斷咗你線，然之後俾第二個講者繼續講㗎啦。咁請問呢個講者你係咪已經講完啦？喉痘呢個議題你係咪發表完公眾評論啊？I hear nothing from the speaker. Can we call the next caller?
Yes, can we have our next caller, please?
我支持後頭緊急措施。
嗱，呢個講者你等一陣先。你發言之前咧，我要強調同你講咧，你而家講緊呢個咧係只係喉痘嘅議題，其他唔關於喉痘嘅議題咧，你要以後先至再發言。如果唔係咧，我哋就會斷咗你線，係轉俾第二個講者㗎啦，好冇啊？
好。
Okay, the interpreter already make the clarification to the speaker, only focus on the monkeypox emergency declaration.
Thank you. Can we have our next caller, please?
我支持後頭緊急措施。
I support the monkeypox emergency declaration.
咁將會有咩措施嚟保護大家？將會。
I want to know that what's the protection can protect us.
我就係支持後頭緊急措施，就咁啦。
That's it. I support the declaration.
Thank you.
Thank you. 多謝你。
Thank you. Can we have our next caller, please?
So supervisors, when we have a hearing like this, it should be meaningful. And right now it's not meaningful. So this emergency has been declared on a national level. We want to know if we have a commander linked to emergency services in the city and county of San Francisco who can do a real needs assessment. Right now, the outreach is not done in a proper manner. And then when you open it up to public comment and don't do it in a meaningful manner, you destroy our democracy. People are like parrots. They are brought there. Maybe they are paid to say something, and they destroy our democracy. We have to have a meaningful hearing. Stop bringing these people who come here just to like a parrot, say something that means nothing. We need a commander to do a needs assessment to see that meaningful outreach is done to San Francisco regarding monkeypox. One of you supervisors had to wait in line for about 6 hours to get a vaccine because the vaccines are made in Denmark. This superpower doesn't have the ability to make the monkeypox virus. You should talk to the people about that. Thank you very much.
Thank you. Can we have our next caller, please?
Yes, hi, this is Kristen Evans. I came in midway on the hearing, but I wanted to call in support of the emergency order. Also had some pretty significant questions and concerns that came up through this hearing. I am working closely with the population that are in the navigation centers, and I was alarmed to hear for the first time today that there was significant impact on the navigation centers and our most vulnerable folks, including seniors and people that have been struggling with other health issues, including the COVID pandemic. I was not satisfied with the response about how they were taking precautions to ensure no further spread in the navigation centers. I would like to hear more about what precautions they're taking in terms of they were in the process of reinflating the navigation centers, basically doubling the capacity in many cases, adding more people, and that just sounds like a really bad idea right now. So I didn't hear anything about pausing shelter reinflation. Are they also pausing intakes to shelters that have had outbreaks? Are they practicing isolation protocols with people? All of these are super important questions to answer. We learned through the COVID pandemic that congregate settings were really a challenging area to provide safe spaces for folks, and that's why the shelter-in-place hotels and non-congregate settings became necessary. I don't know enough about the transmissibility of monkeypox to say whether that is what is needed in this case, but I would have liked to have had more transparency from the Department of Public Health about how they're addressing outbreaks specifically in congregate shelters to ensure that those that are most vulnerable folks, including seniors,
Thank you.
Experiencing homelessness.
Just a reminder, public comment today is 2 minutes, and we are sorry if we have to cut anybody off. Can we have our next caller?
Hi, hello. I call in support of the monkeypox emergency, and I would like to know if possible when will the vaccine be available to the general public, and also what preventive measures can we take in regards to the monkeypox. Also, I would like to draw to your attention.
Thank you. Can we have our next caller, please?
Hello? Hello?
We can hear you. Please start.
Hello? OK， 我講中文嘅，yeah， 我叫阿 Yan。
係你講中文，我係你今日嘅口譯員，係啦，咁咧再一次提醒你咧，而家你發表公眾評論呢一個係關於猴痘嘅緊急宣言嚇，其他嘅問題咧你要留待下一次，如果唔係咧我哋就會斷咗你線㗎啦，咁啊留俾下一個講者嚇。The interpreter make clarification to the speakers like only focus on the monkeypox emergency declaration today. So 你可以開始啦 ，Please begin。
係，我支持猴痘緊急情況。
I support the monkeypox emergency clarification.
Yeah, what is that?
係，你繼續講啊。Hello? I think the speaker cut off. I hear nothing.
We did flag this as inappropriate public comment from our party, and we'd like to move on to our next speaker.
Sure.
Can we have our next speaker, please?
Hello?
Hi, we can hear you. Please proceed.
Hi. Yeah, I'd like to voice my support of the monkeypox emergency declaration. I feel that on the coattails of the COVID pandemic, this is also a cause for concern, and we really need to put all our attention into solving this as well. Thank you.
Thank you. Can we have our next caller, please?
Hello, hi, can you hear me?
Yes, we can. Please proceed.
Hi. Great, thank you. So I'm a healthcare worker. I do want to speak on the monkeypox and all the misinformation that was given actually by our organization and my manager. But before that, I do speak Chinese, so I'm hearing a lot of Asian American Chinese-speaking folks are asking for a special meeting. It looks like they want a resignation of Walton.
Thank you so much for your comment. Thank you so much for your comment. We will ask that you keep public comment to item number 2. Specifically, this is important for everyone as this is an important emergency declaration. Everyone has the ability to email my office. They have the ability to email all of my colleagues. This is an important emergency declaration. Public comment is specific to item 2. If you call in and you are speaking on other items, which you have a right to do, there are other vehicles to do that right now, primarily at this point via email. Please continue with comments specifically to item number 2.
Yes, can we have our next caller, please?
Dear Supervisors, my name is Akash Singh, and I'm a gay person. I'm submitting public comment because I'm fairly concerned about the spread of monkeypox in our city and the lack of urgency exhibited by government agencies in this response, especially the lack of equitable distribution of vaccines, antiviral TPOXX treatment, and supportive care available to those most at risk, including gay, bi, and queer men, sex workers, our trans community, those experiencing houselessness, and folks in congregate settings such as navigation centers and homeless shelters. I also find it concerning that early on, despite growing case numbers, the San Francisco Department of Public Health made an active choice not to prioritize contact tracing of cases, a fundamental public health tool made even more vital given the lack of vaccines. I contacted the county for information on the vaccine. The county told me to call my PCP. My PCP told me to Google for more info. There was vaccination happening a 30-minute bus ride away from me, but I only knew about that because of someone on Instagram. That's ridiculous. I help my partner get vaccinated. I help community members get vaccinated. I'm happy to be someone that people can look to for information on testing, vaccine, and treatment, but that is not my job. It is a job of public health departments. For those reasons, I urge the Board of Supervisors to ratify the Public Health Declaration, to increase transparency and share information with the community about how local agencies are coordinating their response to address the monkeypox outbreak. Additionally, I urge the Board to demand for clarification of public health policies that helped us to tackle COVID-19 disparities, which must now be applied to support a public health response, including renewing the Right to Recover program, allocating resources for contact tracing, funding for individuals to isolate safely, directing agencies to fight against discrimination due to stigma status, and expanding paid sick leave policies while acknowledging the disproportionate harm that is being done to queer people of color by this crisis. I urge you to also continue to advocate with state and federal public health agencies to ensure San Francisco has expanded access to vaccines, testing, and treatment. Please don't fly the pride flag in June and then abandon us in July. Thank you.
Can we have our next caller, please?
Hello?
We can hear you. Please proceed.
Hello? Hello? Hello?
You
Hello?
can start.
Hello?
Hi, we can hear you. You can begin your comment.
Hello? 係咪我啊？
係啊，係到你啦。你係咪要中文嘅口譯服務啊？
係啊，係啊，係啊。
哦，咁咧嗱，我今日而家再提醒你下，你一定係而家呢個發言一定係只係講猴痘嘅緊急疫情，好冇啊？如果唔係咧，你就會斷線㗎，好冇啊？The interpreter clarified to the speakers again, only focus on the monkeypox emergency declaration. So please begin. 你可以開始啦。
係，我係肖明烏。
My name is Xiu Ming Wu.
緊急情況。
I support the monkeypox emergency declaration.
希望政府咧快啲整呢啲藥出嚟嘅救呢啲市民咯，因為後鬥係好嚴重嘅呢個病。
I hope the government can produce those pills to our citizen. 你下邊嗰句係話乜嘢話？猴痘係乜嘢？
好嚴重啦！呢個病情，因為我細個咧已經打咗猴痘㗎啦。
Monkeypox is a easy spread virus. I have the monkeypox when I was kids.
希望政府咧快啲出呢個藥救呢個世界嘅市民啦，唔該。
Hopefully the government can do something, produce the pills to save our life. Thank you.
Thank you. Can we have our next caller, please?
Hi, can you hear me?
Yes, we can. Please proceed.
Great. So, first of all, I really hope that San Francisco, or at least the United States, doesn't bungle monkeypox like we did with COVID. And so, I do 100% support the monkeypox emergency. I really hope, once again, that San Francisco is able to come together, rise up, and help us get these vaccines, make sure that we're all okay. And unfortunately, I also have to state that I hope that the Board of Supervisors must demand Walton's resignation.
Again, I'd like to remind the members of the public to stick to topic item number 2 regarding the monkeypox declaration of emergency. Can we go to our next caller?
Good afternoon, Board of Supervisors. Can you hear me?
Yes, we can. Please proceed.
Oh, okay. Thank you. My name is Andy Stone, and I am a queer person who lives in San Francisco. And I just want to say how infuriating, frustrating it is to hear how this hearing is going right now. I want to thank the Board of Supervisors and the San Francisco Department of Public Health for supporting expanding access to vaccinations and other things. But I also want to really highlight that there are a lot more needs that our community has. And right now we're in the middle of an active crisis. I encourage you to check your emails to see all of the public comment that's coming in via email and other streams. We need more access, more coordinated access to vaccines. We need plans around equity to make sure that people who are monolingual speakers of Spanish and other languages have access to health care. We also need to make sure that we have plans in place for congregate settings where vulnerable people in our community are being protected from the outbreak of this particular virus. Please help us really focus our public health strategy. We need also contact tracing. We need to see a lot more than what we're seeing right now. And while some things have been coming out and been doing well, we're still waiting to see how some of these comments and public health emergency declarations actually get translated into real policy that helps our communities on the ground. Thank you for listening, and yeah, please help us, and please, I'm calling in support of ratifying the public health emergency for monkeypox. Thank you.
Thank you. Can we have our next caller, please?
Hello， 係咪我啊？我都要中文翻譯。
係啊，係你嗱，我係你嘅口譯員啦。今日咁啊，你記住今日咧，你而家發言咧，淨係講呢個猴痘嘅緊急疫情嚇。如果你講其他嘅問題咧，你就會俾斷線㗎啦，知道嗎？The interpreter make the clarification to the speaker only focus on the monkeypox emergency declaration. So please begin. 你而家可以開始啦。
我個名叫做 Mark 靚。
My name is Mark Lang.
我支持呢個猴痘申請緊急情況。
I support the monkeypox emergency declaration.
因為咧呢個病毒嘅傳播咧就好嚴重咁影響到我哋嘅生活，同埋各方面嘅地方。
Because this virus spread will India infect our life.
咁我係一個耆英，我係屬於高危嘅人群，即係喺疫情情況下，咁我有3個建議。
I'm a senior and I'm the high-risk population.
第一個咧就我希望能夠三藩市政府能夠爭取到聯邦政府更多嘅藥物疫苗。
The first, I have 3 comments. The first, I hope the San Francisco's city can apply more vaccination from the state and the federal government.
第二個問題咧，就希望能夠通過傳媒更多咁獲得一個普及抗呢個猴痘疫苗、抗猴痘病毒嘅知識，獲得更多嘅普及嘅知識，點樣防、點樣治。
The second is we want to know more knowledge about monkeypox through the media and how to protect ourselves.
第三個問題咧，就唔好俾嗰啲種族偏見者主持呢項工作。多謝。
I think the third comment is about the racism. So, am I going to interpret or that's
you
it?
do not need to provide those. That was flagged as a subject that we were not taking public comment on today. Can we have our next
Sure,
caller?
then that's it.
又喺嗰度。Hello? Hello?
Hi. Okay, I think this is me. Hi, my name is Patricia, and I support the monkeypox order emergency, and because this is very important for people to prevent to be, catching the monkeypox, and also as a water reside. Thank you.
Thank you. Can we have our next caller?
Hello. Monkeypox. Yes. Support. Wharton.
We're going to flag this item as a non-compliant subject matter. Can we have our next caller, please?
Hi, I support the monkeypox emergency, but also have to be Shannon Wharton has to be defined.
Okay, we're going to have to stop it there. Please note that this is regarding the monkeypox emergency. It is not related to any specific supervisor or anything regarding a specific supervisor. So it must be related to monkeypox declaration of emergency. Thank you very much, and we will be flagging those immediately. Thank you very much. Can we have our next caller, please?
Good afternoon, supervisors. My name is Vinnie Ang. I live in District 8. I want to appreciate the supervisors for their imminent affirmative vote on this public health emergency declaration. And I want to reiterate that in your position of influence, that you must also lift up that this is a global health equity issue, that we must demand that the federal government not only expand vaccine manufacturing with the current existing manufacturer, that it explore options of licensing vaccine production across multiple vaccine producers. The U.S. government invested $1.9 billion in developing this vaccine. There's no reason why they should not be shopping this around to more manufacturers to increase supply. I also want to reiterate and thank the supervisors for flagging the need for non-pharmaceutical interventions, which are available tools for our local public health agency that should be implemented on the heels of the ratification of this public health emergency declaration. Thank you so much for seeing that these urgent issues are attended to.
Thank you. Can we have our next caller?
Hi, my name is Blake Scott, and I live in the Mission in San Francisco. I'm calling to urge you to support ratification of this public health emergency and to demand a more urgent, coordinated response across all city agencies. I'm a PhD immunologist by training, and my summer has been dominated by this crisis. I have counseled loved ones and members of my community to the best of my knowledge and ability. In June, I was notified by organizers of an event that I and some 20 other San Francisco residents had been exposed to in LA. No contact tracing was done by the city of San Francisco, despite the names of affected residents being turned over. None were contacted about their potential exposure. Thankfully, the organizers of the event did the work of the city, and we need the LGBTQ community be included in contact tracing efforts, imperfect as they may be going forward. More recently, I've helped guide loved ones through the difficult process of getting TPOXX, which included difficult experiences at ZSFG, including being shouted at to leave the urgent care center and told that there was nothing that could be done. Ultimately, City Clinic came to the rescue, but negligence by ZSFG, by private providers like One Medical and Dignity Health risk overburdening City Clinic and jeopardizing the health of the vulnerable community members it primarily serves. This community is being left to manage this crisis largely on its own. This is unacceptable. This is your job. Please help us focus our public health strategy. We need contact tracing. We need access to TPOXX. We need better access to vaccines. Thank you for your time. And again, please ratify this amendment for this, ratify this public health emergency. Thank you.
Thank you. Before we move on, I'd just like to give one reminder on the phone number streaming across the screen, which is 1-415-655-0001 to call into this meeting. The access or meeting ID is 2490-070-5729. And once connected, if you do want to speak for public comment on this monkeypox declaration of emergency, you can press *3 to be added to the queue to speak. Can we have our next caller, please?
Hello, hi. This is Selena. I'm a healthcare worker. I just wanted to let you know that there are misinformations being released, even in the healthcare organizations. They're trying to get their admins back to work by saying that this monkeypox is only transmission through sexual activity in the gay community, which is incorrect. The city needs to release and do more outreach to everyone so we know how this is transmitted. And I support to declare this as an emergency for the monkeypox. So please do more outreach and educate everyone in different languages. I think everyone who are even not English speakers should have the right to know and how to protect themselves. Thank you.
Thank you. Can we have our next caller?
Wow, this call has been completely wild. But you know what's more wild? Getting monkeypox. I thankfully recently recovered from monkeypox, but oh my gosh, you do not want this. Reason I'm calling is essentially to say that I support this resolution, appreciate the Board of Supervisors for doing this, but I'd like to, as someone who had monkeypox, I'd like to give some advice. I am privileged to work from home, and so I was able to isolate while still keeping my income. However, if I worked in a job that didn't afford that luxury or required client-facing roles, such as service workers or any other kind of worker who has to come into an office or into a retail establishment, et cetera, then I would have easily lost my livelihood and potentially become unable to pay my rent. So why do I bring this up? What hasn't really been discussed on a federal level or on a local level is hazard payment, essentially, so people can isolate safely. I'm afraid that this disease is going to affect people who are going to have to choose between safely isolating and paying their rent or paying their bills. So I would highly encourage the board to look at ways to expand the COVID isolation payment. I forget the actual technical term for it, but to apply it to monkeypox. I also want to say that getting tested and getting vaccinated was very difficult. I was vaccinated within the 14-day window where the vaccine actually lessened symptoms. So even though I did contract the disease, I had a much less, a much more mild version than what I've seen from other people who did not get vaccinated. However, getting the vaccine was incredibly difficult. I wanted it in May. I couldn't get it until July. And of course, I got monkeypox. And furthermore, contact tracing didn't happen until 5 days after I was given a diagnosis.
Thank you.
And
Speaker
contact
time has
tracing
elapsed.
was not very thorough.
Thank you. Can we have our next caller, please?
Hi, my name is David Watson. I am currently recovering from monkeypox. And first off, I want to say I'm supporting this declaration of emergency. I do have some concern that the problems with testing has not really been discussed during this meeting. Testing is taking way too long. It took 3 days for me to get mine back, and my first test was negative, although I did have it, and the second test confirmed it. So there's a lot of problems with testing. There is no testing that can be done until a lesion actually appears, and that is too long. It's too late. The access to TPOXX, which was a godsend for me, but it took 12 days, and it was 12 days of agony before I was able to get that. And while it is a little easier to get at, it still is not easy enough. And I press on San Francisco to to press on our both state government and the federal government to rectify that. The other thing I was a little concerned to hear that when supervisors were asking about moving forward with trying to help out with workplace pay and stuff like that, that you would have to address that in September. Well, we're in the beginning of August, and while I'm sure you guys deserve a much needed break, my monkeypox is not going away in that time, in a short period of time. I'm now on day 28, and I just call that we need to move faster than that. And it may suck, but you guys need to come together. I'm sorry, shouldn't use guys, but all of you need to come together and start discussing this, and it needs to happen this month as soon as possible. Thank you.
Thank you. Can we have our next caller, please?
Hello， 係我支持猴痘嘅緊急情況。
請問你呢個係我係你今日嘅，你聽唔聽到？我係你今日嘅，
我聽到。
我係你今日嘅口譯員啊！咁再一次重新同你講咧，你而家呢個發言一定係要淨係講猴痘嘅緊急狀況嗰個宣言下。如果你講其他嘅事情咧，我哋係會 cut 咗你線嘅。So the interpreter make the clarification to the speakers and only focus on the monkeypox emergency declaration. So please, hello， 你開始講啦，你可以開始講啦。
我知，我以為翻譯唔會講，同我翻譯添。咁啊唔緊要，咁啊最後一句冇嘢講啊，係Wharton resign。OK， 拜拜。
Thank you very much. We're going to flag that as inappropriate comment, not related to the subject matter at hand. Can we have our next speaker, please?
Hello, hi. Hello. Can you hear me?
Yes, we can. Please
Hello?
proceed.
Can you hear me? Oh, yes. I think the testing for monkeypox takes too long. Also, the test facilities are very hard to access. Also, Shimon Walt.
Okay, again, that is a flagged issue. Please maintain your comments to the monkeypox declaration of emergency. Can we have our next caller, please?
Hello.
Hi, please proceed.
Hello， 我支持猴痘呢個情況嘅緊急措施嘅。
請問你等一等先，你等一等先。我係你今日嘅口譯員嚇，你而家呢個發言咧就只係講猴痘嘅疫情，猴痘嘅緊急狀況。請問你聽唔聽到
？Give us one moment. We're just going to give them a second opportunity to provide their comments after you give them the explanation. They should be able to hear you now, or she should be able to make comments at this time.
係呢位講者，你可以講啦，但係你所講嘅嘢一定係要係猴痘嘅緊急狀況嘅宣言嚇。
我支持猴痘緊急措施。
I support the monkeypox emergency declaration.
Wharton resign.
Okay, again, we will not be giving any additional warnings regarding off-topics public comment. Can we have our next caller, please?
喂？
係你係咪需要廣東話嘅口譯啊？
係你好。
係啊，我再同你重申一下咧，你而家呢個發言咧就只能夠係講猴痘嘅緊急狀況宣言嚇。你如果係提及其他咧，我唔會同你做口譯，同埋會 cut 咗你線嘅。 So the interpreter make the clarification to the speakers again, only focus on the monkeypox emergency declaration. 咁你而家可以請講啦 ，Please begin。
你好，我支持猴痘緊急措施。
I support the monkeypox emergency declaration.
係，民眾需要預防啲咩咧？
Okay, we're gonna. That is a flagged topic again. Mr. Atkins, can you confirm if we have any additional callers?
Mr. Clerk, there are no further callers in the queue.
We have completed the queue for both the in-person speakers in the chamber and those who are called in on the remote system at this time.
Thank you so much. Public comment is now closed. And I do want to appreciate everyone for their comments. Thank you for calling in. Supervisor Chan.
Thank you, President Walton. I just am disappointed that to see that we're really on a critical public health emergency. This is a time that, we see that really primarily impacting our LGBTQ community, that we know that it's already fighting a lot of stigma. It's a critical issue that we should really be focusing on. And then unfortunately to see that there are folks that as opportunists to use this opportunity for their political agenda, it's very disappointing. And as a Chinese-speaking immigrant, I am definitely very disappointed to see that this is happening. And if I may, I would love to have the privilege to speak this in Chinese.
Definitely.
身為一個華人嘅代表市參事咧，我睇到今日咧，我係非常嘅失望，因為我哋睇到咧，呢個猴痘症咧係影響到，尤其是係我哋嘅同性戀社區，睇到佢哋係好有呢個需要。今日其實應該係着重去講關於個猴痘點樣能夠解決呢個健康嘅問題，但係好不幸嘅就係睇到有人利用呢個機會去用自己嘅政治目的去發言。其實如果有呢個不同嘅意見，可以用其他嘅地方去發言，唔需要喺今日利用呢一個機會，因為今日嘅目的係講關於我哋嘅公共健康，而唔係政治目的。所以我身為一個華人市參事咧，聽到我哋嘅華人社區咁樣嘅用呢個政治目的手段咧，非常之失望。Thank you.
Thank you so much, Supervisor Chan. And again, colleagues, I want to thank you for coming in today for this emergency meeting that we had to host and that we had to have. I also want to thank the Department of Public Health for this declaration of emergency so that we can get in front of this virus and do everything we can to avoid any further outbreak. And with that said, Mr. Clerk, would you please call the roll on item number 2 so we can ratify this emergency?
Yes, on item number 2, the motion to approve. On that motion, President Walton.
Aye.
Walton, aye. Supervisor Chan. Aye. Chan, aye. Supervisor Dorsey. Aye. Dorsey, aye. Supervisor Mandelman.
Aye.
Mandelman, aye. Supervisor Marr.
Aye.
Marr, aye. Supervisor Melgar.
Aye.
Melgar, aye. Supervisor Peskin.
Aye.
Peskin, aye. Supervisor Preston. Aye. Preston, aye. Supervisor Ronan, excused. Supervisor Safai.
Aye.
Safai, aye. Supervisor Stephanie. Aye. Stephanie, aye. The motion passes without objection with Supervisor Ronan being excused.
Thank you. Without objection, this motion is approved unanimously. Mr. Clerk, do we have any further business before us?
That completes our agenda for today.
Thank you. The best and most beautiful things in the world cannot be seen or even touched. They must be felt with the heart. Helen Keller. This meeting is adjourned.